I started struggling with my mental health in around fifth grade, but I never sought help until I was in high school. And that was mainly because my school didn't really have a lot of mental health resources. Mental health wasn't really talked about in my school. And I also grew up in an environment where my family didn't really believe in mental health because they also didn't really have mental health education back in their youth. So I kind of was not only did not know what I was going through, but I also didn't really know how to seek help or where to seek help. And I just hope that my story can benefit in any way. And I'm here today because I don't want anyone going through a similar experience like me. And so I guess the biggest challenge for me is really the lack of mental health education. And so I really just hope that for the next generation, there is going to be more education on mental health.
With stigmas, we tend to think of independence as don't ask for help because that's a sign of weakness. Don't reach out for help, you might be a bother. Society might think you can't live on your own. So that's why I didn't ask for help actually until 19. My partner at the time had actually requested me that I go see a doctor. Unfortunately, modern medicine did not work for me. It actually quite numbed me out. I felt more like a zombie. So I felt like I was living in two polarities. When the medication wasn't there, I was feeling a lot of emotions. And when the medication was there, I was feeling nothing. Like I wasn't even feeling happy.
Our struggle started when my son was 14, 2022, just out of COVID. He was struggling with a move, a change of school districts, struggling with going back to in-classroom learning. And he had spoken to us as mom and stepdad about these struggles. We had tried to look for help for him in our local small town. There's not a whole lot of access to treatment in the area. So we really struggled with finding a way for him to get therapy. We did the best we could as parents, allowing him to talk to us as much as possible. He had some medications that needed continued, and we needed to meet with not only a therapist, but also a psychologist. The first appointment we could get was a 9-month wait, and we were expected to drive 2 hours to the closest facility that would take him with his insurance. By this point, he was 15 years old. He had been struggling with this for a year, and he no longer wanted mental health treatment by the time this appointment rolled around. He decided to give up on it, moved to his dad's house. Dad does not believe in mental health treatment, and so things are just kind of left to hopefully he'll come back around and he'll discuss this with us at a later time. We had this window where he was willing to get treatment, and we tried as parents as hard as we could to get him the help that he needed, and the system failed him. And all we can do right now is hope that he comes back around to be willing to get help again at some point, and that he's willing to tell us when that time is.
And I want to first by thanking the panel before us. It takes a lot to come and share your story. And so I just want to uplift and always root my work in your stories because that's why I keep pushing. I think it's imperative that we start early, right? We start before it becomes an identified mental health issue. And helping our students and young people identify emotions, as well as understanding the importance of relationships, the importance and ability to express themselves. Teachers are essential. I do not expect a teacher to be a therapist. That is not what I expect you to be. What I really need teachers to do is understand the importance of kind of the SEL, the basics, and how we're integrating and infusing that in everything they do. Finding options to sustain programming, and this has been one for us, is one which then the school community can actually bite into it and really think about how to integrate it in their school their school environment. Accessibility is definitely a barrier, and so we've been adding programming to support those who, again, need a little help to those that we think need, additional service and support, either in school or outside of school. I think what's key in my messaging is not only the continuum, but partnership. The school districts cannot do it alone.
And this allows us to build relationships with youth before they need these traditional mental health services so that they can feel comfortable asking for help when they need it. I like to say that we are doing suicide prevention every day just by giving kids positive experiences with clinicians and mental health facing programs so that if they are in a crisis, they feel comfortable reaching out and asking for help. I also see the benefits of consistent, positive adults who genuinely care about these kids and their well-being. Even outside of the therapy context, having an adult ask you how you are doing that really cares about the answer, that's super beneficial. We have partnerships where we do after-school programs to bring the services to the kids to really remove any barriers between kids and some of these mental health services, including some of the mental health education that the previous panelists were talking about. A lot of the preventative services that we're trying to keep kids from needing a higher level of care, trying to stop a crisis before it becomes a crisis. And these after-school programs and community organizations are in to talk to these kids who either wouldn't have access to services elsewhere or wouldn't be willing to seek them out.
It's really important to get the large picture. I think the challenge is we have a workforce shortage, addressing the workforce needs and thinking about the role of primary care. So number one, let's start with when you have whole health care, that includes mental health. And in order to be well, you need that whole health care. And how do we help support our primary care partners? So our family practice docs, our pediatricians, there are components that we are growing and knitting together. That notion of medical necessity always tagged to a diagnosis. And how do we expand that or strengthen our ability to access things earlier in a prevention model and early intervention?